morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. Had a really busy day yesterday. Of course, it won't be yesterday when you're listening to this, but we had the Spring Bizapalooza as part of the Roane County Chamber. A lot of good participation last night. I don't think there was any booths left. I don't know. There may have been some agencies, members, companies that weren't able to get a table because it looked like they were full, and there was a lot of people that just came to do the networking and such. So I think that was one of the big gains we made over previous years, where it was, it was like a $15 fee to attend if you weren't a member, and $10 for a member, and exhibitors got free tickets. And we're like, hey, we want the people to come. How about, we're paying rent for the booth. How about inviting anybody to come for free that's in the business community? And I think we had a good time. And I imagine pretty much everybody there, I mean, there's a few maybe not, but most of the people that were there were chamber members. And even if they're not chamber members, again, it's that exposure that people that might not come to your office are coming to the event. So got to talk to some people, talked to a young lady who was a tech student in, I don't know if they were doing something with part of tech or just somebody said, hey, go check this out. Maybe they're business students. I didn't get to talk, but she did pick up one of my dental brochures. So, you never know. Generally, most students are usually still like on their parents' insurance, or there's things on campus that, they have the clinic on campus. They pay so much a semester to be able to have access to go get checkups and get routine prescriptions or something. So, but dental's not covered on campus, and so who knows? She may call and say, hey, I took this brochure. I want more information. I want to get this. So that was good. The other is, I don't think I talked about, I may have mentioned it on one of the previous shows. I'm not sure, but it was a couple weeks ago. Elijah and I went to Brentwood and to the state NABIP symposium. NABIP is NABIP, and it's the National Association of Benefits Insurance Professionals. I was just thinking on that when I was thinking about talking about this, and it's like, it's always been kind of a group insurance broker agency. It has worked mainly with the brokers that work with different employers for their employer insurance, but they also represent us. They are a lobbying organization. And there's been so much upheaval with Medicare lately that, we want to be participating with NABIP and say, hey, you need to be looking out for our interests. We're paying you membership dues. Let's do that. But Elijah and I went to that, and I was, in past years, there was a little bit more Medicare emphasis in it. It was, kind of a mixture. This one here really seemed to be more the group, but they did a thing. We called it speed, the speed networking. They split us up in groups, and then we went around, and not just around the room. It was like the hallway areas and the little side rooms that the vendors had tables set up, and they were mainly vendors who, worked with group insurance brokers. There was a couple, and some of them do the marketplace plans, but they also will offer insurance to small groups, and so they were there. But anyway, Elijah and I ended up talking to a couple representatives from Nationwide. And Nationwide does what they call level funded for small groups. So it's, hey, if your group is all basic, pretty healthy, or doesn't have a lot of health claims, you maybe can get a lot lower rate than if you get just a traditional group insurance plan from one of the bigger insurance companies. And I say bigger. Nationwide's not tiny. I know when I say the name, you're familiar with it. But this division for the group insurance, they're really focusing more on the 2 to 50 employees, which when I was with Health Markets, we started kind of doing that. Was something just the last couple of years that I was involved with them, that we did some small group stuff. So I dabbled in a little bit and kind of like, yeah, this is not necessarily the market I want to focus on. I'm going to focus a little bit more on the Medicare. But Elijah, with his business-to-business sales background, he's like, I really like the idea of this. I've got connections in the, business owners or plant managers and things like that might be interested in something like this. So we'll probably have him on another show to go in a little more detail on it, but it's kind of teasing that one, that we're going to probably talk a little bit more about what we might be doing on the level funded side. The other thing I wanted to touch base on is, and I did put a link on my website, on my Facebook page. About a week ago, I'd gotten an email talking about it, or I'd heard about it. I can't remember where I heard it. I may have mentioned it just briefly on the last show, but the GLP-1s, you're seeing all the commercials on those, that's the latest and greatest thing for weight loss. I'm not here to judge it, say whether it's good or it's bad, but my point was, it's very, very upfront in your face. Everybody's hearing about it. And I've had a lot of clients and friends come to me and asking about, is there a plan that will cover it? My doctor says I need to take this. But the problem there was their doctor wanted them to take it because they really need them to lose weight. But the problem has been that unless you're diagnosed with diabetes, you're not getting this shot. So anyway, bringing that up, and like I said, there is a link on my Facebook page to the CMS website, which is the Centers of Medicare and Medicaid Services. It's the government website, cms.gov, and they're doing a pilot program, and so they're to evaluate the coverage of the GLP-1 medications, and that's, Ozempic, Wegovy, Mounjaro. Some people say Mounjaro. I was saying Mounjaro forever, and then heard a commercial and they called it Mounjaro. So, and Zepbound is the other one. So a lot of doctors want their clients to take it. Maybe, they're creeping up on their A1C, but it's still under 6, but it may be in the mid-5s. And so they want to get the weight off before it goes into that range. I'm one of those. I'm right at about 6 right now. And with the prescriptions I'm taking, I'm not quite ready to do the GLP-1. The last time I met with my provider, she said, oh, yeah, I can prescribe it if you want to try that. And I was like, yeah, let's hold off for now. Let's see what we're doing with what I'm taking now. But the thing is, in Medicare and most insurances, maybe a group plan might, but I know the marketplace plans don't. If it's prescribed for weight loss, they're not going to approve it. Generally, they're going to approve it for everybody if it's for diabetes. And there's a couple of them, it's not all of them, will actually approve some of them if there's risk of heart disease. And it's not necessarily the GLP-1s. I think I take Jardiance. And that's one of those, I think some people take it that aren't diabetic because it does have some indications that help with blood pressure and such. So, and I'm not a doctor. I did stay at a Holiday Inn Express once, but so I don't want to get into diagnoses there. But the just kind of from my experience, I know it's kind of funny. It's like once I started the Jardiance, my A1C dropped. I dropped about 30 pounds. But that's been like 2 years ago, and I'm staying at the same weight. I'm not gaining, but I'm not losing anymore. So that's part of that. My thing on that is let's not just look at some drug as being the miracle drug for weight loss. There's other things that we need to do, and I'm speaking from myself now. I need to do better. Is the exercise, the diet, all that stuff. As they say, drink more water. I love to drink water, but it's got to have some flavor. I've got my coffee right now. I like the seltzer waters. I like what they call them, sparkling ice. I really enjoy those flavored seltzer waters. So that's generally what I'll drink. And diet, Coke Zero or a sugar-free root beer or something like that. I've just always been that way. Grew up we had a natural spring growing up. Everybody, this was before the craze for bottled water and natural spring water, and didn't really know how good I had it, but it was like I didn't want to drink just water. I drank water because if I was thirsty, but if I just wanted something to drink for refreshment, it had to have some flavor. But so what they're going to do is they're doing this test program, and unfortunately the breakdown I got, it's starting, I think it's starting July 1st. If you click on the link on my Facebook, it'll go there. But this one here, I just did a quick summary to get from a chat this morning, and that was one of the things that wasn't included, and I didn't think about that till now. But it's supposed to be starting July 1st, so it hasn't started yet. And then and I believe it's going to be going for 15 months. And I think that puts it to where it'll go to the end of next year, and then they'll determine whether in 2028 that all Medicare plans will approve for this. So keep an eye on it. Can't really do anything with it now. But so like I said, Medicare still generally excludes the GLP-1s if it's only for weight loss. But it's a pilot program, so it's always going to be limited access. And, you're not guaranteed that you're going to be able to get that benefit. But, it is the demand is really growing in the senior community because most of us are diagnosed with type 2 diabetes. We can thank the food pyramid for telling us, we would not eat fats and eat all the grains, and then they realize, all these carbs made us all fat, and in the meat and the fats were actually good for us. So, and somebody will probably comment that I'm wrong on that. But just hopefully you get covered, and it may take and be a matter of your doctor's going to have to still document some extra documentation to get it approved. But one of the big things currently is, if you are prescribed a GLP-1, you're looking at $900 to $1,300 a month monthly out of pocket costs. And you've heard me talk about the $2,100 Part D max out of pocket, thanks to the Inflation Reduction Act. That won't apply to these if they're not approved prescriptions. So that $900 to $1,300 out of pocket is not going to go towards that max out of pocket. You still would have to meet it before those other drugs are covered. And even if you hit that max out of pocket for other prescriptions, these would still be out of pocket. And that brings up the Canadian Med Store. I was talking to somebody about this last night too, and it's like, I always kind of sometimes have to explain to people, it's actually not in Canada. It's in Florida. But business in Florida makes the connection with the Canadian pharmacies, and actually it's not just the Canadian pharmacies anymore. I think lately they've been doing more with New Zealand. So sometimes there is, and it's like you may be dealing with a New Zealand pharmacy and it's still shipped from Canada. They're going to ship it. They're going to source it from wherever they can get it for the least amount of money. It's going to be mailed to you. You're going to have to get a 90-day supply because they're going to mail it. So there is a lag. So it's like, hey, if you're about to run out of your prescription and, I don't want to refill it at the pharmacy. If it's a prescription that you can go a week or two without having, then, order it on short notice. But if you're thinking about maybe looking into going with the Canadian Med Store for a prescription, you need to be thinking about, a month or so out when you're going to actually need it in hand. So if you're about to run out and it's something you're going to have to, it's something you have to take daily, the Canadian, that may not what I'm saying is the Canadian Med Store might not be the right source for this filling of your prescription. Not the prescription itself. It's still going to be a good source. But if you're going to need to be taking, that refill, and I'm thinking something like, like blood pressure medicine, those things that, hey, your blood pressure is going to skyrocket, or, I don't know, I'm running out of examples here. But you want to make sure that you cover it. So anyway, I realized I've done like I did last week. I've ran up on the break. So wrap up this when I come back.
Why go to two companies when one will do? Bundle your home internet and your wireless service with one local company that does both. Twin Lakes Fiber Internet plans start at just $34.99 a month. And when you add Tri-Lite Mobile, your first wireless line is free. That's blazing fast internet speed at home, nationwide mobile coverage on the go, and one local team taking care of it all. Visit twinlakes.net or call 800-644-8582 to learn more today.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, welcome back. We, like I said, I ran up a little on the break there and didn't have a good transition, but I want to try to finish up what I was talking about with the referencing the Canadian Med Store and maybe filling your GLP-1 prescriptions and any other prescription that you're having trouble paying for that you may be able to get it for less. Check it out. It's free to call them. They're very helpful. I work with Amber, so if you call and you can ask for Amber. Or you can go to the CanadianMedStore.com, and there's a form you can fill out. And please tell them I referred you, so they'll continue to be friendly with me. But if it's something you really have to have, you have to take it every day, and you're going to run out in about a week, that this prescription fill is not going to work with the Canadian Med Store. But you may be able to get maybe just 1 month of something and then order a 3-month supply from the Canadian Med Store, and you shouldn't run out of that next month before you get it. But don't count on it being here 2 weeks when you go through that system. It can take longer, so just to be on the safe side, because it is being shipped from out of the country. It may just be from Canada, but it's still going to take a little bit of time to get here. So one of the things, and I talk about why I brought up the Canadian Med Store, and I mentioned formulary is going to be different. Maybe your doctor wants you to take Wegovy and your insurance will cover Ozempic, but they won't cover Wegovy, or they'll cover Mounjaro, but they won't cover Zepbound. So you have to make sure, if you're going to be able to participate in the pilot program, it still is going to have to be, you need the brand be on your formulary, because if it is, then that $2,100 max out of pocket will apply. I know there's going to be some kind of cap on it, kind of like they're doing with the insulin, but I still don't think it's going to be cheap. I mean, it's still probably going to be like $100, I think. I don't think it's going to be $35 like the insulin is right now. So you got to make sure you do that. You're still going to need that prior authorization. You still have to do sometimes what they call the step therapy of, if you're trying one version and it doesn't seem to be getting anywhere, then you may be able to get a formulary exception for one of the other brands and see if theirs works better. They're not exactly the same. They're all the same type prescription, and they're different manufacturers. So sometimes it's not so much the difference in the medicine, it's the manufacturer. That's when it comes to the insurance company paying for it. That's not going to which company it's from is not going to be the deciding factor of whether it works for you or not. It's going to be their formulation of it. So let's make sure we go on that. And then the other thing is they may require you to be doing some type of weight management program. Maybe you need to be seeing a dietitian. Maybe you need to document that you're going to a fitness center. And that's one of the things, if you have a Medicare Advantage, pretty much every Medicare Advantage out there comes with some type of gym membership program. And some of them even have some like home exercise programs where you can get a video. Some of them will send you like the resistance bands, and then you can put a video, on your computer or on the TV and watch and basically work out with the video, and just like you're in a group setting. So that can happen. But one of the things, we always still offer free drug plan reviews, and that's generally going to be in the fall during that fall enrollment season, whether you're on a Medicare or Marketplace plan. We can look at that. We can see if which drug plan works for you. This year, I'm sure it's going to be big change again when it comes to Part D for this year, hopefully for the better. But this last couple of years where we've been dealing with the results of doing away with the donut hole as in having a fixed maximum out of pocket for prescription drugs, and especially the Medicare Advantage plans, a lot of them, they have changed a lot of their benefits because they're having to absorb a lot more of the drug costs, and then the drug plans themselves, most of those have gone non-commissionable. So there's a lot of agents out there that just say, I don't do Part D plans, or I only will do a Part D drug plan review if you're one of my Medicare supplement clients. We haven't got to that stage in our office. We will still do them. But there is a procedure, and actually that was one of the things that came up this week when I was listening to a training and how another agency does it. And I think this is something we are going to have to kind of adopt, is we use a software, an app called Retire Flow. And if you're one of my clients, if you're one of my Medicare clients, you're probably familiar with it. But it's very simple. We send you a link, and you go to that link and you put in your prescriptions, and generally you type the first 2-3 letters, maybe sometimes 4 letters of your prescription, of the name, and then it will give you some options, just like when you do a search on Google and it's like, okay, yep, this is the one I'm looking for, click it. And you'll click it, and then it'll ask you, what's your dosage. Be very careful on that one. There are some that have capsules and tablets. Make sure you're picking the one that's the right version of the prescription you take. Some are a shot, some are a lotion. So you have to make sure you're getting the right formulation of the prescription, and then how often you take it, how often, how many come in when you get it refilled. And that's very important. And the reason I'm bringing that up, in the form does the Retire Flow thing does 3 things for us. It lets you list all your prescriptions, and also pick your preferred pharmacy, so we know, because which pharmacy you have does matter. And then your preferred providers, which if you have a Medicare supplement, it's not a big deal. If you're looking at Medicare Advantage or have a Medicare Advantage plan, it's very important that we know who all your providers are, so we can make sure that we find a provider that you take. And then you sign what's called the scope of appointment that CMS says we have to have before we can present any Medicare plan solutions for you for your drug coverage or your Medicare Advantage plan. So and what I'm saying on that is what this individual had said, and I think we need to adopt that too, is if you want us to review your prescription drugs, you need to fill out that Retire Flow form and get that sent in. And there needs to be a deadline on it, and it's not December 6th. December 7th is the deadline for the annual election period for Part D and Medicare Advantage plans. And we hope we have all the reviews done before Thanksgiving. We really want to get them all done in October. So we'll be reminding people around August, and then in September probably is when we'll send out the links to fill out that Retire Flow. And it's actually, there's things on our website or like our calendar page where you can find the link for that. You can and get that filled out, because October 1st we can do those reviews. When I say we can do the reviews, I'm saying we can review it. That's not when we're going to necessarily meet with you, but we're going to review it, and then after that, and then set an appointment after that to say, okay, we've got some suggestions for you. We need a 15-minute call, or hey, I need you to come in the office. We need to sit down and dig into this a little bit, and maybe take a little bit longer meeting, and figure out which plan will work for you and get that going. But on October 15th, we can do that review from the 1st to the 14th of October, but we can't do any enrollments to the 15th. But on the 15th, we can submit those applications for all those prescriptions, and you're done. You don't have to worry about getting it done before Thanksgiving. You don't have to be worrying about December 7th. You'll have it all done. So that's what we're going to be kind of implementing that this fall. The other thing I wanted to talk to you about before I run out of time, but I do have a thing that I've talked about before, and that's what's called the high deductible G. That is a Medicare supplement, and it works very much like Plan G. If you're familiar with Medicare supplements, you know what I'm talking about. But Plan G, we always think that's the simplest one to sell. It kind of replaced the Plan F as the go-to plan, because people who are new to Medicare can't get Plan F anymore, which there always was a high deductible Plan F also. But here's why I think a lot more people are going to be kind of going for this. We've had some really high rate increases on Medicare supplements the last year, and especially this year. Very high percentage, double digits, some over 18 to 20% increases. And I've gotten a few messages or calls from people say, "Hey, what happened? What's with my rate? Why didn't you warn me?" Well, I've been warning, but anywho, I'm leaning towards really liking that high deductible G. I don't say danger is not the right word, but the thing I tell people, when you're picking a Medicare supplement, you have to be prepared to be married to that plan. And when I say married to that plan is because Medicare supplements are medically underwritten, and down the road you may not be able to switch to another Medicare supplement because your health won't pass the health underwriting. You can always go to an Advantage plan, but you can't go to another Medicare supplement. So one of the downsides of the high deductible G, as they say, high deductible, it's really a maximum out of pocket right now, and I've meant to bring the exact, but it's right around $3,000. But the difference between a high deductible G and the regular G when it comes to the monthly premium is you can save about $100 on the premium. So most people are going to save about $1,000 a year or possibly even more. And right now, like I said, the max out of pocket is like $3,000. So you'd be looking at maybe having about $2,000 out of pocket costs for your health care, but you're saving that $50, that $100 a month. And as those rates go up each year, it's not, the percentage is not going to be as much. And even if the percentage was the same, it's going to be less because you started with a lower amount. So, and I think it makes sense to maybe couple that with what we call a HIP, and you look into our umbrella plans to fill that gap on that. Because the other thing is, Part B, you have that Part B deductible, and then the 20% that a Plan G would typically pick up, you're going to have to pay that 20% until you hit that maximum out of pocket. So, and that's only really going to be an issue if you have a bad year. If you're just going to the doctor a couple times during the year, you're not going to hit that maximum out of pocket, and you're going to have those increased savings. So again, and preventive visits are always covered 100% by Medicare, so that's not going to apply to a hospitalization or a severe illness. That's when something would come into play, and that's why we say, let's put something in place that will protect you against those big out-of-pocket costs. So it looks like I'm about to run out of time here. So just want to remind you, at Matt Libby Insurance, we can cover you head to toe, and it doesn't have to cost you an arm and a leg. And we don't sell you insurance policies. We match you to the right plan. Keep listening to us here on Grace 107.7, and we'll talk again next week on Insurance Matchmaking.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.